Welcome. You're listening to session number 1 in the audio series Overcoming Social Anxiety, Step by Step. It is our goal that through these tapes, when used in a consistent manner, you will be helped to overcome social anxiety disorder, sometimes called social phobia, which affects 7 to 8% of the population and is one of the biggest mental health care problems in the world. Overcoming social anxiety, of course, is not an easy task. We're talking about reprogramming the way you think, changing the way you perceive things, and making it easier for you to live and act in the way you want to. The good news is that today we know how to overcome social anxiety. It has been demonstrated through research studies and clinical experience alike. This audio series will provide you with the necessary tools, methods, concepts, strategies, and techniques to start the process of overcoming social anxiety. The more consistently you listen to the tapes, and the more persistently you practice on the booklet handouts, the quicker and easier your goal will be reached. As a psychologist and director of the Social Anxiety Institute, I feel privileged because I get to see people making progress against social anxiety every day of the week. The therapy is always most difficult at first while you're getting used to the new methods and techniques, and you're practicing to reinforce them. Your practice, in turn, will cause permanent changes in the way your brain perceives things and reacts. The person who is determined to overcome social anxiety chooses to keep going, using the therapy even when life events make it difficult for them. This type of persistence guarantees that a person will get better. When you go through comprehensive cognitive behavioral therapy, which is what we will do on this audio series, your social anxiety will begin to diminish and will allow you to begin leading a life free from undue anxiety, avoidance, and restrictions. There is no way for you to fail in this process. The therapy itself is not difficult. The only thing required is that you set aside 30 uninterrupted minutes a day to do it. If you are persistent and consistent in doing your cognitive behavioral therapy, you will succeed. The only possible way you can fail is if you give up. Luckily, I can tell you that most people do not make this decision. But more concerning this subject later. First, let me introduce myself. I am Dr. Thomas A. Richards, a psychologist who specializes in treating social anxiety disorder. My interest in social anxiety and in helping people overcome this disorder comes quite naturally to me, because I lived through the emotional nightmare of social anxiety myself for well over 20 years. At my lowest point, I couldn't even go outside the house to check my mailbox if I saw the neighbors in their front yards. I was afraid they would talk to me. I would have to answer them, and then I wouldn't have anything to say, and my voice would go weak or give out on me entirely. Just thinking about making a fool of myself like that made me terribly embarrassed. Then I'd slink back into the house and dwell upon how foolish I felt and how stupid I looked until I became depressed over it. I was sure, beyond a shadow of a doubt, that my neighbors were being critical of me. I was sure they thought I was strange and they didn't like me. But later, when I was more calm and rational, I knew in my own mind that these thoughts were basically not true. My social anxiety was a constant daily fear, but I had another fear that paralleled it, that somehow I would lose my job and become homeless. That was irrational too, but it scared me more than anything else, and kept me going back to work even when my social anxiety made me feel like I couldn't take it anymore. The anxiety at work was so powerful and so strong that when some event was coming up in the future that I had to do because of my job responsibilities, I began worrying about it and dreading it months and months in advance. Just thinking about it made me fearful and left a raw, gut-wrenching feeling in my stomach. This extreme anticipatory anxiety I felt is characteristic of social anxiety disorder. My rational brain told me everything was really okay, but my feelings were much stronger than my rational thoughts, and my feelings told me I would fail, I would make a fool of myself, and I would freeze up and not be able to act. During those bleak days, I was a junior high school teacher. Every year, my class participated in holiday pageants and end-of-the-year graduations, which meant that many times I had to walk on stage. Even though I didn't have to say anything, just the thought of having to stand in front of hundreds and hundreds of people terrified me. I can still remember being on an overnight camping trip, hundreds of miles away from the city, and looking up into the clear, starry night sky and having only one thought. Graduation exercises are coming up in 2 months, and you will have to walk your class onto the stage in front of hundreds and hundreds of people. You will make an utter fool of yourself. Every eye in the auditorium will be on you. People will notice your fear and laugh at you. You will be humiliated and want to crawl into a hole and never be noticed again. The social anxiety would turn my stomach raw with fear, and all I could think about was that upcoming graduation ceremony, where I would be the center of attention and give everyone another chance to see me embarrassed and humiliated in public. The excessive anticipatory anxiety killed any peace or enjoyment I could experience in the present moment. As the years went by, and I gradually got better, I found myself in graduate school at the University of Iowa and later at Arizona State University. I eventually earned my master's and PhD degrees. I spent several years as a college and university professor of psychology until I moved back home and opened a private psychological clinic. Since 1994, I have focused on the treatment of the 3 largest anxiety disorders: social anxiety, panic disorder, and generalized anxiety disorder. And contrary to popular perception, the largest of these 3 anxiety disorders is social anxiety. Because of this, we changed our name in 1999 to the Social Anxiety Institute, and now only see people who have some form of social anxiety disorder. It makes me wonder about all the millions of people suffering from this problem who are still undiagnosed and do not know what they're suffering from. 7 to 8% of the population are living through the nightmare of social anxiety this very moment. Only very recently has any attention been paid to social anxiety, and it is still common to find professionals who know very little, if anything, about it. It is typical for a person with social anxiety who comes into therapy for the first time to feel that they are the only one in the whole wide world who has these horrible emotional symptoms we call social anxiety. I understand this. I felt that way all the time myself, many years ago, before there was any research or books available on the subject. Today, luckily, we have both substantive research and clinical experience that helps people with social anxiety realize what they are dealing with and going through. As I mentioned, at the Social Anxiety Institute, we are often concerned about the millions of people who suffer with social anxiety and what the best method might be to reach them. We have debated this many times. For example, I do writing, we maintain several websites, run a mailing list, started a nonprofit organization, and conduct an international comprehensive cognitive behavioral therapy group for social anxiety. While this is all good, these are limited methods and do not reach enough people. We opened a large website on anxiety in the fall of 1996 called the Anxiety Network, and another website in 1999 called the Social Anxiety Network. And according to our email responses, both seem to be very beneficial. But we constantly receive messages from people trying to find a therapist in their own local area who specializes in the treatment of social anxiety, and we have very little to offer them, many times no clue as to where they can receive appropriate local help. Finally, there were quite a few people who emailed us saying they just couldn't go to a therapist's office at all. They were just too anxious. They wanted help desperately, but it was too hard for them to seek treatment. So, could I please do telephone therapy with them? Although we received almost unanimous support for doing telephone therapy, this did not seem practical in terms of the time involved, the necessity of providing on-the-spot cognitive behavioral exercises, and the fact that the effectiveness of telephone therapy has not been demonstrated. It also didn't seem to be the way of reaching the most people in the shortest period of time. So it was finally decided to do this audio series on overcoming social anxiety, with the hope that this series will have a larger audience and a more long-lasting impact for people wanting to overcome this devastating anxiety disorder. For some people, most likely those with minor cases of social anxiety, the consistent use of these tapes may be enough to move them past the biggest hurdles, gradually reducing their social anxiety and giving them the confidence and self-esteem necessary to live happy, normal lives. For other people, most likely the majority of those with generalized social anxiety, the tapes, when used consistently, will prove to be a significant help, providing therapeutic